scent. Good.
Lady is such a hoot. She doesn't want to miss out on any goodies.
All other goats besides Twilight, come here. Wizard, Oz.
Twilight!
Twilight Sparkle is the littlest goat that we have at the petting zoo area. She is a handful. She's got a lot of personality.
Go, Twi, go. Go, Twi, go.
Woohoo! Twilight is a go. Today we're gonna take Twilight Sparkle for a walk around the zoo. It's fun enrichment for her because she gets exercise, she gets to see new things, and it's interesting for the other animals we pass by because they get to see a goat walk around.
She's so good.
She is. She'll go anywhere.
She will.
Enrichment is something that we do to enhance an animal's environment. It mixes up their day, makes things more exciting, and it usually elicits a behavior that they would use in the wild.
Go see Zach, the okapi.
Is he out?
He is. Zach, probably like, oh, okay, another goat. She's back.
You wanna wave? Cute.
She started to get a little bit of arthritis, so movement is good for her to help work her through that. It seems like the more she moves, it seems to get a little bit better. So we take her on walks to help her with her mobility.
Whoa. I think you startled the hornbills. She's an African pygmy goat, so she's got really short little stumpy legs. Her little booty's so cute.
I know. The giraffe is.
Staring at Twilight.
Yep. We do this before the park opens just so we don't have crowds gathering around her because everybody wants to pet her. She's adorable.
The painted dogs are always super excited to see her.
Here they come.
Look, Twi.
Those dogs, they have a great sense of smell, so once they got a whiff of her, they all came running up and were very interested in what we brought over.
They look very eager to see you, my dear. They're licking their chops.
She's pretty fearless. She has an attitude about her. She thinks she'll kick anybody's butt that would mess with her.
Luckily, it's breakfast time for our painted dogs.
These are very heavy rabbits.
Some of them are huge.
Can you smell it, Picasso? Because it stinks. Today we are setting up enrichment for our painted dogs. We're going to be making a fake carcass for them. We are going to be using a cardboard box and stuffing it with bunnies. We like to mimic whatever they would be consuming out in the wild, so that would be any sort of large mammal like a zebra or a warthog. Okay, I really don't want to touch these things.
We have a group of 8 African painted dogs. We have Hatari, the father. He's a very patient single dad. And we have his 7 puppies, 3 females and 4 boys.
We can put some of those logs in there. It can act as the bones.
The bones.
In the wild, dogs are going to be tearing carcasses apart. That's a very natural behavior for them. So we just want to be able to kind of make the best carcass that we possibly can for the dogs.
Appetizing.
So actually how painted dog packs work is the parents will actually let the babies eat first. So even though they're not babies, they are a few years old, Hatari will hang out in the back and he's not really going to go for the food until the puppies have had their fair share. Beautiful. I think we're good to go. Let's do it.
Painted dogs are very different from domestic dogs. They're very cute on the outside when you're looking at them through the fence, but they are predators. They have an extremely successful rate when it comes to hunting. They're definitely not anything I would ever put my hands near.
Oh, someone got something.
Oh, they're spreading them out.
Hatari, go, bud.
Oh my God, he's so cute though.
Right now, it looks like Hatari's kind of wandering around. He looks like he wants to attempt to go for the box, but he's not quite sure.
Have you guys noticed anything with Hatari?
His eyes are still a little puffy. I think he still is suffering a little bit from the allergies.
Yeah.
Hatari has been having some difficulties with allergies lately. His eyes are getting pretty crusty. His muzzle really gets a lot more swollen. Oh, good job, Hatari. Good boy. Hurry, eat it. With Florida's allergy season fast approaching, we're definitely gonna have to step in and help Hatari out a little bit. We're going to be transferring him up to the hospital later this week so the doctors can take lots of tests and figure out what's going on. Good boy, Hatari.
A successful meal.
He has a dad bod.
He for sure has a dad bod.
Nice. It's a good girl, Anne.
This is Lady. You need conditioner. Your hair's crazy.
Lady is one of our half-flamer horses that live in the petting zoo.
She is sassy, opinionated, and definitely not ladylike. So it's really funny that her name is Lady. She's my favorite pony. She's a big sweetheart, but she definitely can push you around as well. All right, Lady, let's see this mask.
She just wants to see what's going on down there.
Oh, yep, it's going up her leg and her thigh, and it feels really hard.
Just a few weeks ago, we noticed that there was a growth on Lady's mammary gland, and it was pretty strange. It was almost like golf ball size in shape, and then just over a couple of days, it started to grow exponentially, and that's when we started to get really worried. I'm really concerned about it just because it is getting so big so fast. It was like lemon size when I first saw it, and now I almost feel like it's football size.
We just don't know what it is and what is causing it to grow. The vets have decided that best case scenario is to give her some type of surgery to remove that mass, because if it continues to grow, it could possibly hinder her in the future.
Well, we can go ahead and get her inside. Dr. Lauren said she wanted to come down to get that blood sample.
What do you think? Go see Dr. Lauren? You like Dr. Lauren.
Today I'm gonna go check in on Lady. I'm gonna get some blood work on her.
Hi, lady. Are you going to be a good girl?
So maybe I'm thinking about it. We ended up consulting with an equine veterinarian, and we elected to move forward with a bilateral mastectomy. This pre-surgical blood work is absolutely necessary for prep for the surgery. It's really important that we make sure that she's nice and healthy and that she's the ideal anesthetic candidate to move forward with this procedure.
What's going on? Nervous? She's like, shh, I don't want to.
Miss Lady.
She said, not today, Dr. Lauren, not today.
Lady has a reputation of certainly running the show. She's sassy, she's large and in charge, so she can be a little challenging sometimes for us to get a blood draw on. Oh yeah, that mask feels solid.
Good girl.
Is it good enough that you will let Michelle get a blood draw on you? We sure do need it.
Wanna try it?
Yeah.
Let's try it.
Michelle, you want to come up on my side? Michelle, she's done Lady's blood in the past, so Lady definitely knows when Michelle's around and something's up, that a blood draw might be happening.
Lady, come on, Munchkin. Get in those ears.
Yeah, she's listening though.
She's giving Michelle a little bit of an attitude, so we're gonna have to continue to work with this and see what we can do. If Lady's just not wanting it, she can certainly just walk right all over you. What do you guys think? Want to try one more time? We do need to get this blood.
Yeah. After a certain point, she just keeps getting amped. She's not gonna.
You're okay. Back up.
So what we're gonna do is have Michelle be a decoy on the side, and Dr. Lauren's gonna pull from the left side.
Right here, right here. Good job, yes. Good job, Ladybug.
You did it, lady.
Good girl.
Yeah, we tricked you.
Woohoo! You're so brave.
All right, glad you got it.
Yeah, no, that was important for us to get, so thank you so much.
Yeah, of course.
I got to palpate that mass. It is solid. That entire left gland is affected, and it's starting to track upwards, which is why I think it's really good that we're doing this ASAP. Okay. It'll be really interesting after the surgery what it comes back as.
Okay.
Thank you.
Thank you, guys.
Thank
Thank you.
Good job, Stinky Butt. I'm sorry, it's so funny.
Like, I just let you do a blood draw, and you're playing with things that I don't like.
Here at Zoo Tampa, we have two Saimeng, a breeding pair, Sensei and Hutan.
Saimengs are a type of gibbon, and they're found in Asia. They are known for their very loud vocalizations.
They have these unique inflatable throat sacs that can amplify their booming calls and can be heard up to 2 miles away.
A couple of times a day, usually, they will do a duet, and it's kind of a bonding ritual between a pair, and the longer the pair is together, the more complicated their song becomes, and so it's been interesting to watch these as they have developed their pair bond.
This morning, I got a call from Jane, and she was very excited to tell me that we had a Saimeng baby.
Oh, that baby's so freaking cute. Look at that little cutie pie.
I was so excited, I ran straight to the Saimeng building. I wanted to see that baby right away.
Baby's nursing right now. Eyes are bright, wide open. We suspected she might be pregnant, but we certainly had not verified anything. She just started to look a little bit chubby, and we came in this morning, and lo and behold, we have a new Saimeng. Everything is looking really great so far. We are so ecstatic about this new baby Simang. She's been on birth control, so sometimes oopsies happen, and this was an oopsie, but I'm really excited to go look at it this morning. Is it time?
We're ready.
Okay. Ready for the big debut.
Hey, happy parents. How you doing? Congratulations.
Oh, hello. Wow, very alert.
Isn't that the most adorable face you've ever seen?
So with it, hello. With primate babies, that initial bonding period with the mother and the baby is extremely important. We only intervene if there's an indication to intervene. So if the baby's holding on, nursing, we're seeing good maternal behavior on the part of mom, everything's going really well, they know what they're doing, and we don't need to do anything.
She holds her legs up. She like doesn't trust that baby's gonna hold on.
What a good mom. Well, I don't think that baby could look any better.
Yeah. Good job, Bhutan.
Yeah.
Good job, Sensei.
Yeah, you did good.
If you're good with it, I think Jane and I are both comfortable.
Yeah,
with
that
letting
baby's
them out.
hanging on, and she does her little extra thing
Yeah.
to make sure, so yeah, let's do it.
We are gonna let Simang, mom, dad, and baby out for the first time. They're doing fantastic, so we think that she's ready to go outside. Their happy place is up in the trees, even with a brand new baby. You ready to go?
She's ready.
Sensei, Bhutan, outside.
Here we go. You can do it, Uthon.
First, it's the rocks.
I got
Hold on.
too. She's so good. Good mama. Oh my gosh.
Oh boy.
Seeing Bhutan take the baby all the way up to the top of their habitat is scary. All of our hearts were just frozen.
You can't just stay still, huh?
Here we go. You can do it, Uthon. We got a surprise at the zoo this morning. We got a baby Simang. It was a total surprise to me. I was not expecting it at all. Oh my gosh. It's nerve-wracking to me still to watch an animal go straight out with a brand new baby and go straight to the top of their enclosure. I would be a helicopter mom up there where I would just be like, no, you're not doing that. Primate babies, they gotta be able to hold on right from the get-go, because you can imagine in the wild, mom is swinging way high up in the Asian forest. So that baby's gotta be born strong and have that instinct to hold on, because they're gonna be moving through the trees with their mom. But that's what they do, and it's normal behavior, and the best thing to do is to treat them like their normal routine, and that's what happens in the wild.
You can't just stay still, huh?
She's walking the tightrope, she's moving around the habitat. She is really fun to watch because she's doing this very carefully. She's making sure she's giving the baby extra support when she's doing this, but she's on her normal routine doing what she would normally do.
And Sensei's like, I can't be far away from my baby. Simangs are kind of unique among primates where the male is very involved in taking care of babies. They're a monogamous pair, which means that they will bond and stay together for life. I just love what a good dad Sensei is.
How much he already loves that baby. He wants to see that baby. He wants to get as close as he can, but he's being very respectful of Bhutan, who isn't quite ready for him to be that close. Who loves that baby more, him or us?
I don't know.
I don't know either.
Look at her go. Oh my gosh. Oh my God.
They grow up so fast. We have 3 binturongs. We have Soli, who is our male, Melati, who is our adult female, and then we also have Kartika, who is their little girl. A binturong is also known as a bear cat. They are found in the forest of Asia. They are neither bear nor cat. They are a species all on their own. I absolutely love them. I mean, it would be hard not to. They are very curious. They always keep us on our toes, and they have such different personalities that you never know what you're gonna get.
Kartika. She is about 4 months old now and due for her last set of vaccines. She's just been a lot of fun to watch her grow and watch her personality develop. Gosh, I can't get over how big she's getting.
She is getting really big.
Hopefully she'll cooperate.
All right. Hi. Kartika. Kartika, come.
It took the animal care team about a month to train Kartika to go into the little half PVC tube that allows us to give her her vaccine voluntarily.
That's a good girl.
She's very, very calm and accepting of the vaccination. I might go for that front leg to start if that's okay.
Yep.
She's in a really nice position.
Very good.
Ready?
Yep.
Done. You're being a very good girl. Binturong are classified as a vulnerable species. They're vulnerable to extinction. So watching Kartika grow and hitting those milestones is really important for us to be able to provide the best care that we possibly can to this species. Done.
You're all done.
Good girl. That was the last of your vaccines. She was a complete champ. Now she's all done until she's about a year old.
You're such a good lady.
The tube works so great.
Yeah.
She's also very food motivated. She goes bananas for bananas.
We have had the Binturong for about 2 years. Our goal was to get them here, get to know them, get them introduced, maybe have a baby, which we succeeded at. And now that they are doing really well and they're growing, we want to be able to give them an area where guests can see them and enjoy them as much as we do. So we have some really exciting changes coming up for our Binturong family.
There is some planning and renovations to one of the enclosures on the public area.
We're very excited to get them over there. There's lots of trees for them to climb on. They're gonna have a nice water feature.
And once that's ready, then the whole family group will be moving out for everybody to be able to see Kartika grow and see her and her mom and dad.
Alrighty. Great, thank you so much.
Thank you. She's all done now with her baby vaccines.
You're a big girl.
Every last little morsel. Use your paw. Yes.
I love working with apex predators. They provide such a unique challenge. These animals are gorgeous, they're smart, they're so much fun to watch and work with. But you always need to keep in mind that apex predators like tigers, bears, wolves, and painted dogs are extremely dangerous.
Good to open. Hi, guys, let's go.
Oh my God, they're actually all
Good
Hi. Good
Hi, Hatari.
Over the past year or so, Hatari started to develop an allergic reaction to something in the environment. When you look at him at certain times of the years during certain seasons, he'll get puffy eyes, he'll kind of get like a puffy snout, and he'll scratch at it. We have him on allergy medicine right now, but it's not totally taking care of it, so we need to figure out kind of what's going on and what's going to be the best route for him. They're starting to separate him now.
Let me set up here then, that way I'm out of their way.
Right now, we're going to do a full immobilization on Hatari so we can get everything we need to set him up for success. Once he's secure, we're going to go in, remove him, and transport him up to the hospital where we can get his procedure going.
Oh, he's mad. He says, I'm not dumb. I've done this before. One of the things that we have to do to safely get hands on African painted dogs is to immobilize them with Jardiance. You guys are okay. Sedation is something that we do routinely for us to be able to safely get hands on our patients, but in doing so, we have to still be mindful of the potential risks. Nice, Lauren. All right hip. Let's see. Just gotta get sleepy, buddy bear.
Hey, buddy. Good boy.
Right now, I'm just watching his respiratory rate. I just want to make sure he's breathing well. The next step is just making sure that he's sleepy enough for us to be able to go in and get hands on. I think we look pretty good.
Yeah, I don't see anything. All right, ready?
Once Hatari is completely sedated, you kind of worry, are they still taking breaths? Is their heart rate still okay? Is their heart beating? That's always something you have to consider.
Nice breath. He seems pretty sleepy.
Yeah. Okay, you're good. Let's get the stretcher. As soon as Hatari is down, the clock starts ticking. And now everybody has to work together to make sure that this procedure goes off without a hitch. Can I send Leah and Brandy in here with you guys?
Yep, absolutely. I just need someone to hold his head. Let's just shove that in there and give him some oxygen.
AC to all African units. We're headed to the hospital with Hatari.
You have a heartbeat? It's hard to hear in the car. I'm breathing. Since the first got in the car.
We're on our way up to the hospital. We just noticed that he's not really taking any breaths on his own, which can be concerning.
Hatari's breathing has slowed down substantially, so it gotta act now. This is not going how we had hoped. Hey, Rob, let's go ahead and stop and intubate him real quick. Come on. Let's go ahead and open him up.
AC to all African units.
Today we're doing a full workup on Hatari. We're hoping to find just some clearer answers on what is actually causing Hatari's allergies and see if there's any way that we can help him.
I've seen one since we got in the car. Hey Rob, let's go ahead and stop and intubate him real quick. Hatari seems to not be breathing as frequently as he had been. We don't have time to go to the hospital. We need to stop right now and address the situation. Let's go ahead and open him up. This isn't the normal setup that I use to intubate animals. Intubating is where I'm actually going to put a tube into the animal's airway, and this can help me control his breathing. There we go. All right, let's roll. I think we just need to get there.
All right, we're moving.
It makes you stop breathing because you're kind of scared for him. We want to make sure that we're doing everything in our power that he makes it through this entire process.
He's already intubated. I just really need to get a good heart rate on him.
Okay.
He just wasn't breathing great on the transport.
Oxygen here. His color is good.
His color's much improved. Hatari seems stable. He's got a good heartbeat. His respiration rate is going well. I feel comfortable moving forward with this exam. You can see he's really erupted.
Oh, it's hard.
Mm-hmm. It's that thickened skin when it gets chronic like that. It's called lichenification, like lichen, and that just means that it's been just very chronic. It's not often that I'm getting hands on Hatari, so I want to really make the most of it, and we're going to do as much as we can in a short amount of time.
No, these are not bad. I mean, there's some tartar in there, but how old is he now?
10.
Yeah, that's great.
Today we've asked Dr. Nico to join us to assist with Hatari's procedure. In his full-time day job, he's a small animal veterinarian. Nico, if you want to do the punch biopsy, that's one of the things we wanted to grab.
If I see a painted dog, I'm thinking about a regular domestic dog. And I'm gonna treat you very similarly as I would have treated your own pet. But different that this animal, if he wakes up, it's not gonna be fun for him or for me or for the staff. So 2 samples Lauren and I got.
Okay,
I think
great.
that should be representative.
Now let's get set up for x-rays.
Okay, prepping.
All right, I'm gonna step out.
Shooting.
This animal has such an amazing genetics. They are lean, they are just athletes. Hatari, he's a good looking animal. He has a big head, good shoulders, strong back legs, so he's in top shape. I think we got what we need.
Okay, I'd like to be done now. So Nico, we need to get the reversal drugs.
Okay.
And then I think I'm gonna turn him off ISO because I just don't want him breathing on his own. I'm gonna give him a breath and then let's disconnect him and put him butt first into the crate. This is a really important part of the procedure, just as important as the induction and the whole workup is a safe recovery. Get the nose out. That way I've got access to the airway. All right. He's got reversals in. The minute we start to see arousal, pull it.
Breathing okay?
Mm-hmm.
Good.
He's picking up.
We're just watching, waiting for him to make a little subtle movement, and all of a sudden he just tried to move his head, tube comes out, door comes down.
Oh, good. Save the ear.
That's what, yeah, that's all.
Nicely done.
Right now, he's recovered, he's in the crate. We're gonna make sure that he's stable and then move him back to the habitat and get him back in with the rest of the pack.
He's all secure in here.
Yeah. We went through and checked all the locks just to...
Thank you. Oh, he's mad. Hatari's back up on his feet. You can kind of hear him working in that crate and growling a little bit. It's very intimidating.
Ready? 1, 2, 3.
I'm going to be reviewing x-rays, go look at blood work, and we'll have the biopsy results in a few weeks. All this is really valuable information for us to get a sense of Hatari's overall health.
I do feel really bad for him. I want him to feel more comfortable, so we're just gonna keep him on meds for now, and then hopefully see if we have any answers for those allergies.
Great job, everybody.
Good boy, Hatari.
Hi, y'all.
You're such a good boy.
I love the petting zoo animals just because they all have their own personality. This is Comet. He just really enjoys rubbing your face. They love being with you, which I think is an awesome thing for animals to want. Oh, you're so excited. Such a good boy. So since COVID-19 hit for the past year, the petting zoo has been closed. So they're not getting all the guest interaction that they used to. We have to make sure that we're giving them all the tactile, all the petting, all the scratches to get that attention that they crave. Right, Django? I do think the goats definitely miss the interactions. I know there's all these people that you want to love. They are social animals, so they really do love the attention. And of course, I don't mind that at all because that means I get to spend extra time with my animals. I am definitely a one woman. I'm outnumbered by goats. I know I miss Lady too, but she's in good hands.
Loaded on the trailer with apple slices yesterday. Ah, apple slices, excellent.
Lady's having her surgery today. She's at a equine surgical facility. She has a mass growing on one of her mammary glands. So she's basically having a radical mastectomy. Very uncommon in horses for something like this to happen, which is why she's here to have a board-certified surgeon do her surgery.
So this is her mammary tissue, and there's just kind of a mass-like appearance in this region. About 3 weeks ago, the zoo contacted us to let us know that there was some swelling on Lady's left mammary. In the matter of a couple weeks, it has increased about 3 times its size. It does make me a little bit more concerned that it might be cancer. Everyone ready? Yes. Inducing. For surgery, we're going to give an injectable anesthesia, which is going to have her lay down. Once they're anesthetized, we have a hoist system that will pick them up and lay them onto the table. This is considered very safe. It looks a little bit strange because they're kind of hanging upside down, but they're very well supported, and it's a safe way to transport them. And I want her butt as close to the back as possible.
Horse surgeries are pretty intense when they're laying on their back like that. Obviously, their legs are the most dangerous part for them kicking. So having the surgeon right there in between those back legs, the anesthesia person needs to really be careful that that animal is not going to move a muscle because it's a big, dangerous animal to have under anesthesia.
All right, are you guys good if I cut? Yes, we are. Cutting. The mammary gland has very large blood vessels that go to it, so it's going to be essential to find those blood vessels and tie them off before you cut them, and then remove the tissue as gently as I can to take it away from her body. First giant vessel. See that?
Oh my gosh,
yeah. Very big. Go ahead and cut, please. I can't dissect all the way here, so I'm just trying to find the best path that I can take. Today, we're going to do a mastectomy on Lady's mammary region. It's a little bit risky based on the amount of blood vessels that are going to it. Go ahead and cut, please. Whew. That'll make you sweat a little bit.
It feels funny to us to turn one of our animals over to somebody else because we're so used to taking care of them ourselves. Everybody at the hospital wishes they were here right now. Definitely gonna be taking some pictures and letting everybody know how she's doing. Everybody's behind Lady, 100%.
So that, I think, was the one that made her concerned. Dissect off quite well. Okay. Her mammary gland is significantly bigger than what you would expect. Worst case scenario is cancer. We'll send the mammary tissue off for them to look at under a microscope, and they'll kind of tell us what type of tissue it is and what we have going on.
You should start being able to close her now. They warned us that a lot of times it splits open when they stand up, and I can see why. It's a big opening and we have a hard time keeping it closed, which is why it's kind of a long recovery. I'm sure they will close it the best they possibly can.
Everything can come off, we're done. Now that she's done, we're gonna lay her on a big mat that supports their muscles when they're laying as the anesthesia is wearing off. It's okay, it's okay, it's okay. Good girl. Okay.
I brought Lady some carrots. When you visit your friend in the hospital, you bring them some flowers, but when you visit your horse, you bring them carrots, right? As soon as her doctor says it's okay, she will definitely get to have some carrots.
Hello.
Dr. Mark, how did it all go?
It went well, yes. I'm happy with the margins and everything.
Good.
The tissue around that was kind of inflamed and irritated, so definitely we need to get that sent off for histopath to see what we're dealing with.
All right, I hope it stays closed when she wakes up.
Yes, I know. There's a lot of tension on that.
Yeah, that defect is quite the thing to close.
It is.
There she goes. Come on, honey. Almost got it.
You can do it.
There you go.
Good
There you go. Hello.
Good girl. Lady is back up on her feet. She's gonna have about 2 weeks where we're trying to get the skin to heal, but she'll be able to go back to her normal life relatively quickly.
Good girl, sweetie. She'll be here for the next several days as she starts healing up, and then she gets to come back to the zoo. She's probably thinking, okay, I'm ready to go back now.
Oh, that's so pretty. Do scratches feel good in the morning? You can rest on my shoulder, but don't rest on my head.
Bhutan, do you have a boy or a girl? She's like, as long as it's healthy, that's all she cares about. So baby is actually 2 weeks old today, doing all of the milestones we'd expect to see so far. We're very pleased with both mom and baby's progress.
Look how cute.
Oh, they're so ready.
Hey, Jane. Hi. You got some snacks for the Siamese?
Yeah, we brought some grapes and cantaloupe.
Hopefully with these goodies here, we can get her to come over and get a good look and make sure baby looks good and alert.
Sounds good. Sensei, come.
Good boy.
Good boy.
Bhutan, come. Good girl. The baby's definitely got more hair.
I feel like it's awake more than it has been.
I feel like it's looking around a lot more too.
It definitely pays attention to us, and that's a new development.
I am so ecstatic that there is a Siming baby. I remember starting on the primate team and I immediately was like, I need these two to have a baby because they're perfect. And they stole my hearts instantly. Mom, can you stop moving? Oh, look at her knees.
See, it's so cute. It's like a little baby cradle.
I love it.
Can you imagine? If my babies had held on to me like that, life would have been so much easier. I think everything looks great. Such a cute little family.
Yeah, it is.
All right, guys, enjoy your snacks. We'll see you later.
Love you.
Hugs and kisses.
Little tiny gentleman. So proud of you. Honestly, when I first thought about working with animals, it was just to be around the animals. Want this yummy papaya? As I continue on in my career and learn more about every species, it's interesting to think that I could play such a big role in the future of animals and really help people understand that they're not just cute and cuddly, that they also have needs. I couldn't have asked for a better career. Oh, you're beautiful, huh? Ready?
Ready. We are excited.
Jacob?
Hello.
Hi.
Today's the day. Bintrongs are moving to our Asia department today, and it's gonna be hard to see them go. They had access to both dens last night, and they decided to all sleep together in Den 2.
In true Binturong fashion, they are sleeping in. It's always on their terms. All we can do is ask, and if they decide that they're not ready and they'd like to sleep a little bit longer, we'll have to come back a little later.
Hey, Sully's getting up.
Hi, Sully.
Hey, old man.
Hi. Maybe we can get him first.
He said, I don't even need you guys. I'll do it myself. Good boy. Oh, close it. Yes.
So to start off this morning, we're going to move Sully first, get him over to the habitat, and then we're gonna have to come back and we will try to create Kartika and Melody at the same time.
We got Sully.
Sully, you have no idea what's about to happen.
But it's gonna be good.
It's gonna be
It's a
amazing.
good thing.
Okay.
Primates to animal duty.
Go ahead.
We are transporting Binturong from Pottus Building to Asia.
Okay, I copy.
Enjoy the view. Take in all the sights.
Today is finally moving day. The Binturongs are going to move from the habitat where they've been behind the scenes to their new habitat in the Asia area.
Our plan is to bring Sully over first and open his kennel right inside the habitat.
It just like hit me.
The smell, yeah.
Oh no, just that he's moving.
Oh, I was gonna say, there's also the Binturong smell.
Oh yeah, the popcorn.
Yeah.
The Binturong smell like buttered popcorn, so it's always fun to work around them unless you're really hungry. Then it really makes you want some popcorn.
We're getting ready to get Sully out for the first time, and I can already tell that Sully arrived because I can smell him all the way from out front. Smells like you're walking to a movie theater. What's up?
Hi.
Ready to move in your new residence?
Yeah. We could put a popcorn stand right here.
All right.
Are we good?
You're good. Moment of truth. The best part is he has no idea what's about to happen.
No, he doesn't.
Okay, opening up. What do you think, Sully?
Welcome home. We were a little bit worried that Sully would be intimidated when we let him out, that he would scurry into the corner.
Here he comes.
Oh, look at him. But he started scent marking everything. So they're super scent motivated, and that is their main source of communication.
I'm so proud of him. He's
I
doing
know.
really well.
He's gonna have a busy day of scent marking everything.
Oh, it's awesome. He's so cute.
Where do you think he's gonna go first?
The best chilling spot is above the waterfall.
Yeah.
I have been waiting for this moment for a long time, for them to come to Asia. When I was on primates, they were one of my favorite animals to work with just how unique they are. It was almost like goosebumps, where I was like, holy cow, we finally got to this day.
We're home. What do you think, Sully?
He looks so good.
This is where Binturong needs to be.
Uh-huh.
Look at him in this hammock.
Does he really sleep in the hammock?
Yeah, he sleeps in it.
He likes breakfast in bed, so we'll feed him in the hammock.
Great. Everything about Binturongs is new to me, so this is going to be a great experience for me to learn what really makes them tick, when they're motivated, when they're not motivated, what they really like to eat, their personalities. Everyone in the team is so excited to learn a whole new species.
He looks fantastic.
I know.
Yeah.
It's fitting right in.
I think these guys are gonna be great out here.
The guests are gonna love it.
You're not usually shy. I know. You like all the attention.
Hatari! Buddy. Ew, dude. Recently we did work up on Hatari just to do an overall health assessment, but also to try to figure out what is going on with his allergies entering the springtime season.
Hey, Sydney.
Hi, good morning.
I just wanted to check in on Hatari.
Yes.
He's been on the antibiotics and just wanted to see if the antibiotics were helping at all.
It's tough.
It's tough, yeah?
Yeah, he's very puffy, really, really itching with his front paws.
Was he? Okay.
Yeah.
Hi, sweet boy. Come here, let me see your face.
Okay, buddy.
Recently, we did a biopsy, and we got a little sample of his skin to submit to the lab. It showed a lot of chronic inflammation, and the findings were very consistent with environmental allergies.
It seems that his left eye is starting to get worse.
Yeah, he definitely is. He might need to bump up his Apoquel.
Yeah.
We've tried to taper back his medication to a lowest effective dose, but every single time he erupts with more lesions. So given the information that we have with the biopsy, with the blood work, we can safely continue him on this medication, but at a higher dose. All right, I think I'll get that started. We'll continue the antibiotics. I still think that's important.
Thank you, Lauren.
Yeah, thank you. I really do think we're doing everything we can to make sure that Hatari, as he gets into his golden years, has a really comfortable life.
All right, we'll be back with more later. Good boy.
Today I'm gonna head over to Pony Barn and recheck Lady, or Halflinger pony. It's been a while since she's had her surgery, and I'm just gonna see how she's healing up. Hello.
Hello.
How's Lady?
She's fantastic.
Awesome. The team has been super diligent in doing her aftercare. I've done hydrotherapy, wound care, walking her. All of this was to help her heal. So we got some of the biopsy results for the left gland. I'm still waiting for everything on the right, but
I'm definitely hoping that this is not life-threatening. I've been with Lady for at least 5 years now, so she means a lot to me. So I'm hoping for some good news.
So we got some of the biopsy results for the left gland. I'm still waiting for everything on the right, but the good news is it didn't come back as cancer.
Nice.
It came back as severe inflammation. The exact cause was not determined, but could certainly be hormonally induced. And even though it wasn't cancer, that would have still been pretty dangerous if it continued to grow. But I think this is what's going to be best for her in the long run. I was hoping to check her incision site and see what it looks like today.
We can definitely try.
When was the last time you seen it?
Since last week.
It's like only like this big, golf ball sized.
Oh, it's tiny.
Tiny, tiny.
This looks fantastic. It's nice and pink. It looks super healthy. It's healing up really nicely, and I don't see any evidence of an infection, so this is absolutely what we want. Oh, is that her?
Yeah. Just get in your butt. Lady looks amazing. She's acting and behaving normally. That surgical site is closing faster than we expected, so we're really, really excited about that news. Oh, does Dr. Lauren want to feed her real
I would
quick
love
one
to
more
feed
time?
her. She's probably mad at me.
Say she is the best vet ever.
I feel like right now we're bonding a little bit. I think she's maybe giving me some forgiveness. She says that's a step in the right direction. Good girl.
All right, Lady, let's go for a walk.
Walking Lady is just really important for her health. This is very much like physical therapy. Getting her that exercise is very important, and it's a big process. Today she's walking incredibly well considering how recent her surgery was, so we're really excited to see that.
You would never know that she even had surgery. She's walking great, going further distances. Good job.
She has so much energy.
She's like, I can do this all day. We are seeing no signs of pain at all. There's no stiffness. There's no favoring of any side, any leg. There's no weird gait going on. She is perfectly perfect.
She did really well.
You did so good. I am so happy that you're doing well. Love you.
Love you.
I think he might have the cutest face out of all of them. Asia to primates.
Go ahead for primates.
I thought you guys would like to know that all the binturong are out on habitat.
Oh, yay, good news. We'll come over and check it out.
10-4, we'll meet you out here. It's been a few weeks since we've moved our binturong family to this big, beautiful habitat here in Asia Gardens. We have been anxiously waiting for all 3 of those binturong, especially Melody, to come out and join the rest of the world on the outside. And today was that day. Melody decided to come out with Kartika and Sully.
Let me see you stand up like that, Colin.
Yeah, now that we got them out, they won't go inside.
Hi, Kartika. Are you coming to say hi?
She just looks so grown up now.
We got a weight on her 21 pounds.
That's insane.
Just a little bit less than Sully.
She's like showing off for everybody. Yeah. I love it.
We're all really happy that they have this really nice habitat just for them, and we can finally show everyone who comes to Zoo Tampa just how amazing these guys are.
Look at her go. Now what are you gonna do?
Kartika is showing off her parkour skills. She's climbed a tree, she's climbing upside down. She's having the time of her life, I think.
Melody's awake now.
That's the most she's moved all day. That's it.
Where's Sully?
He's sleeping on the ground.
Oh, yeah. Aww.
Yeah, I think Kartika ran by and woke him up.
It's exactly what we hoped for when we wanted to move them over here, that they're exploring. Kartika's running and jumping all over the place, so I think they look fantastic.
I do miss having them over in primates, but it's everything we hoped for.
Yeah. Well, you guys can come by whenever you want.
Help us get them inside.
Yeah, that would be a huge help.
Binturongs.
Binturong.
It's been a few months. Sensei and Hutan's baby is doing really well. Today we finally settled on a name and we decided to name it Kazuki. Kazuki is of Japanese origin, just like the dad, Sensei. It means peace and hope, and also tree, which is really cool because not only do Saimeng swing in the tree, but Hutan actually means forest. So it's kind of tying the 2 names of its parents together.
Sensei, Hutan, come.
Aww, good job. Hi, Kazuki.
Now that Kazuki finally has a name, it's even more special to come in and interact because now it's an individual and has its own personality. If we can just figure out if it's a boy or a girl now.
I'm pretty sure it's a boy. I'm pretty sure I saw some dangling parts yesterday.
The next step is Hutan getting to know the name Kazuki, because what we'll work on next is her presenting Kazuki to us so that we can examine different parts of the body.
Where are you going, Hutan?
So I'm ready to go outside.
You have to tell the world your baby's name.
Go sing it out loud.
So we are, again, going to let the Saimengs out on habitat and welcome Kazuki out and announce to everybody that we finally have a name for our adorable little Saimeng baby. It's a big responsibility coming up with a name.
It is.
They're a cute little family.
They are.
Now with Kazuki, it's just complete.
It is. The last few months, getting to know Kazuki has been one of the highlights of my career. It's a really cool adventure, seeing how Sensei and Hutan have a part in its life. Have a good day, Kazuki.
Bye,
We love
guys.
you.
Sing it out loud so everyone can hear.